Hi, this is Jessica DeMassa in the Guidewell Insights Lounge here at Singularity University's Exponential Medicine 2017. Joining me in the lounge right now, we have Shoshana Ungerleider, and she is the founder of EndWell, which is an organization that is putting together a conference and some other things to help curate a conversation about end of life. So Shoshana, welcome.
Thank you.
Pleasure to have you. So tell me a little bit about this conference that you're planning. It's in San Francisco, is that correct?
It is in San Francisco.
And when is it? Give us the dates.
Yes, it's December 7th, of 2017, a month away, happening in San Francisco. Mm-hmm. It's EndWell.
Okay.
People can find out more about it at endwellproject.org. It's really the first of its kind, interprofessional convening, looking at what it means to live well until the very end, and how can we transform the end of life into a more human-centered experience from the perspectives of technology, of media, policy, healthcare, the arts, education, really opening up the conversation to a much more interprofessional group of people.
This is interesting. So who are you targeting to attend this? Like, who is your target audience?
Anyone that cares about transforming the end of life experience.
Okay.
Honestly.
And the end of life experience as it is now, I feel like this has been a topic of conversation that keeps coming up over and over again. Mm-hmm. What's wrong with it right now?
Well, we don't have enough time to go over it all, but
give me the highlights of what's wrong.
I think it's really important for people to understand that by default, you will receive aggressive, invasive care, no matter how old you are, no matter how sick you are, even if it won't help you. That's sort of our default protocol in the United States, and unless you opt out, very loudly and say, I don't want that.
And even then, it may not be accepted.
And even then. And so I think, for me, as a physician, it's really all about making sure that the care people receive is care that they really want and that they understand. And really it's about honoring the way that people have lived their lives, looking at what's most important to them, what are their goals and values for living their life for as long as they have left.
And when you talk to people, I guess, about this, what are some of those goals and some of those things that people want to preserve at the end of their life? Like we had talked earlier, about aging well and about preserving your elderly years and being able to enjoy a quality of life that matches what it was when you were younger, or at least to have the mobility or be able to have the faculty of being able to think. And remember things clearly. And so what do people point to as what does it mean to end well?
Gosh, great question. And honestly, what we're finding and what my own experience as a physician has shown me that there isn't a one size fits all. I mean, people have such varying thoughts about what it means to end well. I think that it's very important that we keep it a broad conversation, such to not place a value judgment on this is how it should be, or this is a good death and this is bad, but rather saying, what's most meaningful to you in your life, and how can we best support you to have an experience that's, in line with that. And I think that the field of palliative care has been really, really pivotal in making sure that, people and their families are at the center of these conversations, and that it's about what's most important to them. So it's a good question. It's tricky to answer because everybody has a very different.
I was just wondering maybe if there were some core themes that people had kind of have bubbled up to the surface based on what you're hearing. Is it people, I want to retain mobility, or I want to retain whatever it is. I was just curious.
Yeah, no, absolutely.
So tell me, you're talking about EndWell being an opportunity to bring together people who want to transform the end of life experience. Mm-hmm. And I'm curious to know, how do you transform it? So it's whose mindset needs to shift? Is it us as patients? Is it the provider? Is it the healthcare system as a whole? What kind of shift in thinking needs to happen?
So I would say it's all of the above. So we're all kind of in this together. And I mentioned last night during my talk that, ending well is a human issue, not a medical one, not a policy one. We're all in this together. I think that there are many, many ways that culturally we have barriers to discussing issues related to end of life. I think systemically, looking at the healthcare system and healthcare policy, we clearly don't have incentives aligned in order for people to make sure that their voices are heard.
Talk a little bit more about that. What incentives need to be aligned?
Well, currently, as it stands, as I mentioned, by default, you'll receive
treat, right.
aggressive invasive care, and it turns out doctors actually get paid to
More
do
of
that.
that. Okay.
So the more that we do to people, whether it's a surgical intervention, some kind of procedure, or an ICU admission, that's how the system, pays us. And so it's not that doctors are all focused on just trying to make money, but rather that's kind of culturally how we're taught to practice medicine is, what can we do to help this person to prolong life?
Sure.
And, instead of sitting down and talking to patients and explaining, well, gosh, here are your options, I think we default to a lot of intervention and doing more to people. And so I think that we're moving toward a place in medicine where we're much more interested in sort of value-based care. And I think that will shift the conversation.
Sure.
But we have a long way to go. And we have a long way to go in medical education.
Yeah, I talked a little bit, I was just going to ask you, as a physician, when somebody says to you, I want to end my life well, or even in your own life, how do you contribute to that? And what's your role? And what if it's counter to what you as a physician are inclined to do? I mean, it may not be to aggressively treat something, but to provide a treatment. It's like, how do you juggle that? When it's like, it's not the right, it may not be the right thing for you to do, from a medical standpoint, it's not following your instinct, but it's what the patient wants.
Gosh, that's an excellent question. I think that it first starts with making sure that all doctors and really all healthcare staff are trained to be having these kinds of conversations. It turns out that a recent Journal of the American Medical Association paper came out last year showing that 70% of physicians haven't been trained to have these conversations. So that's mind-blowing, given that a lot of what we do is talking to patients, explaining prognosis, going through goals of care, and not just doing things to people, but rather, having these really important discussions. And so I think a lot of the focus of my work is around making sure that all doctors, no matter what field of medicine they go into, is that they're trained in how to talk to patients, effective communication.
Provide us with some tips here. I mean, we have a lot of people watching this live stream right now, and they're from all corners of the world and all corners of medicine and health. So give us some tips.
Gosh, some tips. I think practice makes perfect. So I think that it's never easy to walk into a situation, especially when you don't know a patient or know their family, and broach a difficult topic. And it's always hard the first several times.
Sure.
But just kind of recognizing that and going back and thinking hard. I think really, really important questions are sort of, what's your understanding of your illness? And what does it mean to you? And I think you can sort of build a lot of rapport that way. And then dive more deeply into topics to discuss whatever it is that's important. I will also say that there are a couple of really fantastic communication training programs for doctors. So not only doctors that are focused on end of life, but really anyone in the practice of medicine, such as Vital Talk. They're based here in the U.S. and really do an incredible job of teaching all healthcare providers really how to get at some of these very difficult topics. And it's for nurses, for doctors, for social workers.
Sure.
And they do a fantastic job of workshops in that arena.
That's fantastic. Well, Shoshana, thank you so much for joining us and for telling us a little bit about everything. Now, again, talk about the End Well Conference. Give us those dates again, and how can people find it?
So End Well Symposium is happening December 7th in San Francisco. More information at endwellproject.org.
Fantastic. Thank you so much.
Thank you.
So thank you guys who are watching the live stream. We are going to be kicking it live to the main stage here very shortly. We've got a few more interviews for you to watch that are basically from the last couple days here in the Insights Lounge. A lot of great stuff, a lot of great ideas coming across. So please be sure to stay tuned. We will be back live a little bit later from the Insights Lounge, and definitely again at the end of the day with Daniel Kraft to provide an end of the day recap. Here's a package from Bakul Patel. This was an interview that we did with him yesterday. And for those of you who may not remember who he is the very energetic co-founder of Viome. And so this interview is all about the microbiome and some of the work that he's doing there to help kind of bring microbiomic testing and test results into the healthcare consumer life. So this is a great interview. It's amazing what you can learn. So stay tuned. We'll talk to you soon. Please continue to keep the conversation going on our Twitter feed, #XMed. And if you wanted to see any more of these wonderful interviews from the Guidewell Insights Lounge, I've been so privileged to have such great guests all along the way here, particularly our live guests who we kind of throw into the fray with us. All of these interviews are available on Guidewell's YouTube channel, along with the other Insights Lounge activations that have taken place at some of the other really big health innovation conferences. So take a look at that full playlist because it is pretty impressive. And there are those XMed interviews from years past, so you can see how I've aged. And you can hear about how some of these transformational innovations have been evolving throughout the last couple of years. Here we go with that interview with Bakul Patel. We'll talk to you guys later. This is Jessica DaMassa from the Guidewell Insights Lounge at Exponential Medicine 2017. Thanks.